West Virginia Free CNA Practice Test with answers 180 questions. Full review. Question 1. A nurse aide enters a room without knocking while you are providing care. What is the best response? Option A. Please knock next time to respect the patient's privacy. Option B is say nothing to avoid a conflict. Option C. You should have knocked first. Option D. Say to the resident she is always rude like this. The correct answer is option A. Please knock next time to respect the patient's privacy. Aides have a duty to protect resident privacy. Reminding a coworker to knock is a professional way to enforce standards. Question 2. The CNA is performing CPR with a second rescuer. At what rate should CPR be performed? Option A 100 to 1. Option B 30 to 2. Option C 15 to 2. Option D 45 to 1. The correct answer is option B, 30 to 2. For an adult with 2 rescuers, the compression to ventilation ratio remains 30 compressions to 2 breaths. Question 3. Which activity can be completed by a nurse aide? Option A administering intravenous medication. Option B addressing a wound. Option C assisting with bathing. Option D to assess change in mental status. The correct answer is option C, assisting with bathing. Nurse aides are trained to assist with activities of daily living such as bathing. Meds and assessments are outside their scope. Question 4. What is the best way to speak to an agitated client? Option A in a soft voice. Option B in a questioning voice. Option C in a calm voice. Option D in a loud voice. The correct answer is option C, in a calm voice. In a calm voice. When a client is agitated, do not escalate the situation. Speak in a calm and assertive voice and try to find out why the client is agitated. Use simple sentences and don't argue or disagree. Ensure the client is safe. Question 5. If the CNA sees a coworker spill water while bringing a pitcher to a resident, what is the CNA's best action? Option A. Quickly wipe up the spill. Option B. Task housekeeping to clean up the spill. Option C. Report the colleague to the nurse. Option D. Wait and tell the coworker to clean their mess. The correct answer is option A. Quickly wipe up the spill. Quickly wipe up the spill. A spill is a safety hazard for everyone. Every team member is responsible for safety and should respond quickly. Any other option wastes time and is unnecessary. Question 6. The CNA is preparing a surgical postoperative bed. Where is the top sheet placed? Option A. No sheet is placed on the bed. Option B. Fan folded at the side of the bed. Option C. Fan folded at the end of the bed. Option D. Folded at the head of the bed. The correct answer is option B. Fan folded at the side of the bed. Fan folded at the side of the bed. The top sheet is left untucked at the foot of the bed. The top sheet is fan folded together at the side away from the door. When the client is transported, the gurney can easily be positioned next to the bed. Then the client is gently moved onto the bed and covered by the top sheet and blanket. Question 7. According to the Patient Bill of Rights, clients have the right to all of the following except: Option A. Make decisions. Option B. Free healthcare. Option C. Refuse treatment. Option D. Expect confidentiality. The correct answer is option B. Free healthcare. Free healthcare. The Patient Bill of Rights describes what clients can expect when receiving healthcare. It does not include the guarantee of free healthcare. Question 8. The CNA is working on a hospital surgical unit. Which of the following post-op clients will require log rolling? Option A. A client recovering from spinal fusion. Option B. A client recovering a kidney transplant. Option C. A client recovering from abdominal surgery. Option D. A client recovering from a knee replacement. The correct answer is option A. A client recovering from spinal fusion. A client recovering from spinal fusion. Log rolling is a positioning technique that maintains spinal alignment and prevents further injury. The bed is in a flat position. At least 2 healthcare workers are needed to turn the client with one single motion. Question 9. While brushing a client's hair, the CNA observes several sores on the scalp. What is the CNA's best action? Option A. Report the sores to the nurse. Option B, shampoo the client's hair and scalp. Option C, apply antibiotic ointment to the sores. Option D, ask the family to provide lotion. The correct answer is option A, report the sores to the nurse. Report the sores to the nurse. The CNA should report all observations and changes to the nurse. The nurse can then assess the client and determine proper action. The CNA scope of practice includes providing basic care and assisting with the ADLS under the supervision of a licensed nurse. Question 10. After a client receives an enema, what should the CNA be prepared to do? Option A, encourage the client to ambulate. Option B, assist the client to the toilet. Option C, place the client in a prone position. Option D, offer the client a meal tray. The correct answer is option B, assist the client to the toilet. Assist the client to the toilet. Following an enema, the client is instructed to remain on their left side, Sims position, and hold the solution for as long as possible, about 5 to 10 minutes. The CNA should be available to assist the client to the toilet when the client feels the need. Question 11. When taking a client's vital signs, the client tells the CNA that they are experiencing constipation. When the CNA notifies the nurse, what diet can the CNA expect the client to receive? Option A, full liquid. Option B, high fiber. Option C, residue-free. Option D, low sodium. The correct answer is option B, high fiber. High fiber. Constipation can be relieved by a high fiber diet. Fiber adds bulk to the stool and helps push food through the intestines more quickly. Fiber-rich foods include fruits, vegetables, grains, and nuts. Question 12. The CNA is caring for a client who is recovering from major surgery. The client speaks a different language and seems to have many questions. What is the best way for the CNA to communicate with this client? Option A, contact the hospital's translation service. Option B, rely on a smartphone translation app. Option C, ask the client's family to translate. Option D, use gestures and facial expressions. The correct answer is option A, contact the hospital's translation service. Contact the hospital's translation service. This is the best option for legal medical issues. Family members may be helpful for understanding more about the client, but misinterpretation is possible. Smartphones and gestures can also be helpful, but not for legal medical issues. Question 13. Which of the following should be reported immediately to the nurse? Option A, weight gain of 6 pounds since yesterday. Option B, respirations of 16 breaths/minute. Option C, blood pressure of 114/70. Option D, blood glucose of 75 mg/dl. The correct answer is option A, weight gain of 6 pounds since yesterday. Weight gain of 6 pounds since yesterday. A gain of more than 3 pounds suddenly can be a sign of sudden fluid retention from heart, kidney, or liver. A BP of 114/70 may be low or normal for the client, so the CNA should check previous readings before informing the nurse. A blood glucose of 75 mg/dl is near the low range for a client with diabetes. It should be reported, but is not urgent. For clients without diabetes, 55 mg/dl is considered low. The normal range of respirations is 12-20/min. Question 14. HIPAA guarantees a patient which of the following rights? Option A, informed consent. Option B, respectful care. Option C, protecting information. Option D, active participation. The correct answer is option C, protecting information. Protecting information. HIPAA guarantees patients the right to confidentiality and privacy regarding their health information, including access to their records, the ability to request corrections, and control over how their information is used and shared. The other options are included in the Patient Bill of Rights. Question 15. A phlebotomist is a medical professional who is trained to: Option A, perform brain surgery. Option B, draw blood samples. Option C, administer ECGs. Option D, provide hospice care. The correct answer is option B, draw blood samples. Draw blood samples. Phlebotomists are healthcare team members who are trained to perform blood draws on children and adults. They draw blood and collect samples from clients and prepare it for testing. They are skilled at venipuncture, finger pricks, and heel pricks. They can also work at blood banks, collecting blood and products. The other options are incorrect. Question 16. The CNA enters a resident's room and discovers a fire in the wastebasket. The resident is about to enter their room. What is the first priority? Option A. Extinguish the fire if possible. Option B. Activate the fire alarm system. Option C. Confine the fire by closing doors. Option D. Remove the resident from the area. The correct answer is option D. Remove the resident from the area. Remove the resident from the area. The CNA should first remove the resident, as well as anyone else who is nearby, away from the area. When there is a fire, the most important action is to rescue everyone in imminent danger. Next, the CNA should activate the fire alarm, then contain the fire by closing doors. If possible, the CNA can extinguish the fire. If not, then evacuate. R rescue/remove A. Activate the alarm. C. Contain E. Extinguish/evacuate. Question 17. When the CNA forgets to lock the wheels on a wheelchair and the client falls, what should the CNA be charged with? Option A. Negligence. Option B. Battery. Option C. Malpractice. Option D. Assault. The correct answer is option A. Negligence. Negligence. The CNA could be charged with negligence because they did not use medical equipment properly, or as they were trained to do. Malpractice is when actions or failure to act do not follow the accepted standard of care, resulting harm or injury to a patient. Assault is when someone creates a reasonable fear of imminent harm. Batter is actual and unlawful physical contact or harm on another person. Question 18. Using a 24-hour clock, how is 3 p.m. written? Option A. 1500 hours. Option B. 1:30. Option C. 3 o'clock. Option D. 30:00. The correct answer is option A. 1500 hours. 1500 hours. Using the 24-hour clock, time is written in HHMM format, hour minute. Time starts at midnight, and goes through 23:59, 11:59 p.m. Minutes go from 00 to 59, so 3 p.m. is 1500 hours. Hours before 10 a.m., 10 o'clock, are written with a 0 in front, so 9 a.m. is written as 9 o'clock. Question 19. Which of the following observations by the CNA should be reported immediately to the nurse? Option A. Client reports a sudden loss of vision in one eye. Option B. Client reports poor sleep because of noise on the unit. Option C. Client reports an improvement in their appetite. Option D. Client reports muscle soreness after physical therapy. The correct answer is option A. Client reports a sudden loss of vision in one eye. Client reports a sudden loss of vision in one eye. Losing vision suddenly is a medical emergency and requires immediate treatment. Vision can be lost in one or both eyes, loss of partial vision, or loss of central vision. There are several causes of loss of vision, including a stroke. The other observations should also be reported to the nurse, but they are not medical emergencies. Question 20. When giving a new resident an orientation to their room, which of the following instructions is most important? Option A. How to change TV channels. Option B. How to adjust the room temperature. Option C. How to use the call signal. Option D. How to flush the toilet. The correct answer is option C. How to use the call signal. How to use the call signal. Learning to use the call signal is the most important thing for a new resident to learn. The resident should understand when to use it and how staff will respond. Explain that it's for the resident's safety. The other items are useful, but not the most important. Question 21. When providing client care, standard precautions are required for all of the following body fluids and secretions except Option A. Urine. Option B. Sweat. Option C. Vomit. Option D. Blood. The correct answer is option B. Sweat. Sweat. Standard precautions are the basic level of infection control that should be used in the care of all patients all of the time. They apply to blood, all body fluids, secretions and excretions, except sweat, whether or not they contain visible blood, non-intact skin, and mucous membranes. Standard precautions include hand hygiene, respiratory hygiene, PPE, cleaning/disinfection, and waste disposal. Question 22. Before collecting a sputum sample, what should the CNA ask the client to do? Option A. Rinse their mouth with filtered water. Option B. Spit into a kidney basin for 1 minute. Option C. Avoid drinking fluids for 30 minutes. Option D. Rinse their mouth with mouthwash. The correct answer is option A. Rinse their mouth with filtered water. Rinse their mouth with filtered water. This is to remove any food or particles. The best time to collect the specimen is in the early morning. Procedure 1. Use a clean container. Do not open it until ready to collect the sputum. 2. Ask client to rinse their mouth with water and spit it out. 3. Ask client to take deep breaths through their mouth and cough up sputum from deep in their lungs. 4. Open the container and hold it close to the client's mouth. Ask the client to cough directly into the container. About 1 to 2 teaspoons is enough. 5. After collected, screw lid on tightly, label and bag the container according. Question 23. When the CNA delivers a breakfast tray to a Muslim client, the client refuses to eat because the tray includes bacon. What should the CNA do? Option A. Tell the client to eat everything except the bacon. Option B. Ask the nurse to order a halal breakfast for the client. Option C. Remind the client that the hospital dietitian knows best. Option D. Take the tray and give the client juice and crackers. The correct answer is option B. Ask the nurse to order a halal breakfast for the client. Ask the nurse to order a halal breakfast for the client. The CNA should remove the tray and ask the nurse for a halal option. The nurse can also change the client's diet on the care plan. Question 24. Before transferring a client from their bed to a wheelchair, what is the first thing the CNA should do? Option A. Lock the wheels of the bed and the wheelchair. Option B. Let the client dangle their legs before standing. Option C. Raise the head of the client's bed. Option D. Assist the client to a full sitting position. The correct answer is option A. Lock the wheels of the bed and the wheelchair. Lock the wheels of the bed and the wheelchair. This prevents falls during transfer. Once the wheels are locked, can help put on footwear, assist the client to the edge of the bed to dangle their legs and carefully stand and pivot toward the wheelchair. Ensure client's legs are in contact with the seat of the chair before lowering them into position. Question 25. The CNA who works at a long-term facility is introducing themselves to a new resident, Mary Hudson. What is the best way to learn how the resident wishes to be addressed? Option A. Wait until learning what the nurse calls her. Option B. Call her by her first name, Mary. Option C. Ask her family how to address her. Option D. Ask her how she would like to be addressed. The correct answer is option D. Ask her how she would like to be addressed. Ask her how she would like to be addressed. It's important to be respectful. Do not call someone by their first name until you get their permission. Unless the resident is unable to speak, ask them directly how they would like to be addressed. Always introduce yourself first. Tell the resident your title and how you'll be caring for them. Question 26. After helping a client to use the toilet, the CNA prepares to provide perineal care before returning the client to their bed. If the CNA discovers there are no washcloths or wipes in the bathroom, what is the best action? Option A. Tell the client to remain still and quickly leave to get supplies. Option B. Return the client to their bed and then perform perineal care. Option C. Use the bathroom call light to ask a team member to bring supplies. Option D. Wait until the next toileting to provide complete perineal care. The correct answer is option C. Use the bathroom call light to ask a team member to bring supplies. Use the bathroom call light to ask a team member to bring supplies. The CNA should remain with the client, never leave a client unattended when they need assistance to use the bathroom. It is inappropriate to postpone perineal care. Question 27. Which of the following is the best way to clean the indwelling urinary, Foley, catheter tubing? Option A. Use a gentle back and forth circular motion all along the length of the tubing. Option B. After cleaning the perineum and upper legs, start where the tubing enters the body and move down to the collection bag. Option C. Start at the collection bag and move up to where the tubing enters the body. Option D. Use a firm up and down motion all along the length of the tubing. The correct answer is option B. After cleaning the perineum and upper legs, start where the tubing enters the body and move down to the collection bag. After cleaning the perineum and upper legs, start where the tubing enters the body and move down to the collection bag. Question 28. What is the most effective way to prevent the spread of infection? Option A. Remaining home when sick. Option B. Getting recommended vaccinations. Option C, proper hand hygiene. Option D, appropriate use of gloves. The correct answer is option C, proper hand hygiene. Proper hand hygiene. Hand washing is the most effective way to prevent the spread of bacteria and viruses. Using soap and water is the preferred method. Alcohol-based hand sanitizer is also effective. Question 29. The CNA observes a client taking money from the purse of a visitor. What is the CNA's best action? Option A, tell the visitor about the theft. Option B, continue to do assigned work as usual. Option C, approach the client and demand the money. Option D, inform the nurse about what happened. The correct answer is option D, inform the nurse about what happened. Inform the nurse about what happened. The CNA has an ethical duty to report the theft but does not have the authority to intervene. The CNA should let the nurse or supervisor know, because that person is responsible for handling incidents and ensuring all policies are followed correctly. Question 30. The CNA enters a client's room and finds that the client has fallen to the floor. What is the most important thing for the CNA to do? Option A, call for help and start CPR. Option B, call for help and turn the client on their side. Option C, call for help and return the client to their bed. Option D, call for help and remain with the client. The correct answer is option D, call for help and remain with the client. Call for help and remain with the client. If the CNA discovers a client on the floor, they should call for help and remain with the client. Trying to move the client back to bed could cause further injury. Turning a client on their side is an appropriate action or an active seizure to prevent the client from aspirating. There is no indication that the client is unresponsive or not breathing, so initiating CPR is not appropriate. Question 31. The CNA is feeding a client with Alzheimer's disease. During the meal, when should fluids be offered? Option A, throughout the meal. Option B, before starting to feed. Option C, only at the end of the meal. Option D, after each bite of food. The correct answer is option A, throughout the meal. Throughout the meal. Fluids should be offered at regular intervals during the entire meal to help the client's mouth stay moist. It makes it easier for the client to chew and swallow. Clients who may require feeding include those with cognitive impairments. Question 32. A resident with dementia has difficulty understanding explanations about their care. What is the most appropriate way to communicate with the resident? Option A, speak slowly and loudly to make sure the client hears. Option B, use simple words and demonstrate what is happening. Option C, avoid as much verbal communication as possible to reduce confusion. Option D, give detailed instructions so the client has more information. The correct answer is option B. Use simple words and demonstrate what is happening. Use simple words and demonstrate what is happening. When communicating with a client who has dementia, use simple words and short sentences. Demonstrating what is happening or how to do something is also helpful. Avoiding communication is not good client care or respectful. Giving detailed instructions only adds to the client's confusion. Speaking slowly and loudly is not useful or respectful. Question 33. While assisting a resident with their shower, the CNA observes a reddened area on the resident's sacrum. The area does not blanch, turn white, when the CNA presses it. What stage is this pressure sore? Option A, stage I. Option B, stage 2. Option C, stage 4. Option D, stage 3. The correct answer is option A, stage I. Stage I is stage 1, a red or blue area that may look like a bruise. It does not turn white when pressed. The skin is not broken, it may feel warm to the touch. Stage 2, area becomes an open sore that looks like an abrasion or a blister. The skin around the sore may be discolored and the client may complain of pain. Stage 3, sore deepens and looks like a crater, usually dark patches of skin around the edges. Stage 4, the sore now extends to muscle, bone, or joints and cause a serious bone infection, osteomyelitis. Question 34. The CNA is assigned to care for a client with measles, which requires airborne precautions. All of the following PPE is required except Option A, booties. Option B, gloves. Option C, gown. Option D, N95 mask. The correct answer is option A, booties. Booties. PPE for airborne includes gloves, gown, and N95. The client's door should also remain closed with a notice on the door. Booties are not required. Question 35. A client has an irregular heartbeat. When taking the client's pulse, how long should the CNA count? Option A, 60 seconds. Option B, 30 seconds. Option C, 15 seconds. Option D, 45 seconds. The correct answer is option A, 60 seconds. 60 seconds. When a pulse is irregular, it should be measured for a full minute. With heartbeats that are not consistent, counting for 60 seconds is the best way to be accurate. When a pulse is regular, 30 seconds, multiplied by 2, is adequate. Question 36. The CNA finds a terminally ill client crying alone in their bed. What is the CNA's best action? Option A, leave the room to provide privacy. Option B, offer to sit with the client for a while. Option C, encourage the client to watch TV. Option D, tell the client that everything will be okay. The correct answer is option B, offer to sit with the client for a while. Offer to sit with the client for a while. The client may feel lonely, scared, depressed, or anxious. They may want to talk to someone who can listen with empathy. Family and friends may stay away because they don't know what to say. The client may just want someone to be nearby. Ask them what they need. Do not deny the client's feelings or try to distract the client. Question 37. The CNA who works in a pediatric clinic weighs an infant and documents 4.6 kilograms. What is the infant's weight in pounds? Option A, 8.2 pounds. Option B, 6.9 pounds. Option C, 10.12 pounds. Option D, 2.09 pounds. The correct answer is option C, 10.12 pounds. 10.12 pounds. To convert kilograms to pounds, multiply the number of kilograms by 2.2. For this question, 4.6 kilograms x 2.2 equals 10.12 pounds.